Hi everyone, this is Dr. Divya Shanthi and welcome to NEET PG Core Revision series. These series are structured, focused and exam oriented so that you can recall faster and more confidently in your exams. In today's session, we are going to break down the portal vein and portocaval anastomosis, which is a very important topic, into clear, high-yielding, exam-focused concepts. So let's get started. Okay, so the course of the portal vein is divided into two portions. One is the extrahepatic, another one is the intrahepatic. And when we see the extrahepatic part, it has three portions, that is the infraduodenal, the retroduodenal and the supraduodenal. So this is the supraduodenal. This is the retroduodenal portion here. This portion will be the retroduodenal. And here will be the infraduodenal. So these three portions, they form the extrahepatic part of the portal vein. So this extrahepatic part is about 8 centimeters in length and 2 centimeters in width. So they run towards the portal vein. So after the formation, it goes towards it enters within the right free margin. Okay, after the supraduodenal portion, it enters the right free margin of the epiploic foramen. Okay, epiploic foramen, and reaches the porta hepatis. So where it reaches the porta hepatis, it will divide into the right and left portal veins. Okay, right and left branches. So sometimes the trunk here of the vein, it will present a dilatation, which we call it as the portal sinus also. Sometimes if there is a dilatation of the trunk, we call it as the portal sinus. So it's basically the dilatation. So the right branch, if you see, it is shorter compared to the as well as more vertical compared to the left. The right branch will be receiving the cystic vein here. The left branch is larger and more oblique. So they both open into the physiological lobes, that is here physiological lobes of the liver. The right and left lobes, they open respectively, the right and the left. So now here we will just see the extrahepatic course. So the extrahepatic course, I told you there is supraduodenal, there is retroduodenal and the infraduodenal. Now the infraduodenal, in front, it will be related because it is formed behind the neck, right? Neck of the pancreas. So it will be related in front to the neck of the pancreas. And behind there will be, so anteriorly there is neck and posteriorly there is the inferior vena cava. Okay. So right side, on the right side of it, on this side, here you will see the bile duct. That is the infraduodenal. Whereas when we see the retroduodenal portion here, so retroduodenal, in front will be the first part of the duodenum. So you will see the first part of duodenum. Behind there is the inferior vena cava. Okay, posteriorly we will see the inferior vena cava. So inferior vena cava forms the posterior relation for all the three portions. Then we come to the supraduodenal. Supraduodenal portion is within the lesser omentum. So it will be running along the free margin of the lesser omentum. Okay. So this supraduodenal part in the front, okay, in front of it and to the front as well as to the right, there will be the bile duct. Okay. So anteriorly and right, there is bile duct. And in the front and to the left, there will be anteriorly and left will be the hepatic artery. Hepatic artery will be there, which is surrounded by the hepatic plexus of nerves as well as the lymphatics. Then posteriorly behind we will see posteriorly we will be seeing the inferior vena cava. Okay. So these are the relations. So this here it will be separate inferior vena cava by the epiploic foramen will be there in between. But these structures, they form the relations. Okay. So this is the extrahepatic portion. So extrahepatic we divide into infraduodenal, retroduodenal and supraduodenal. 3 parts in relation to the duodenum. So infraduodenal, in front we will have the neck of the pancreas, behind there is inferior vena cava and to the right side there is the bile duct. And retroduodenal, in front there is the duodenum, behind there is inferior vena cava. And the supraduodenal part which runs along the free margin of lesser omentum, we will see anteriorly and to the right there is bile duct. Anteriorly and to the left of it will be the hepatic artery with the plexus of nerves, hepatic plexus of nerves as well as lymphatic sphincter. And posteriorly there is inferior vena cava. So, and at the porta hepatis, so at the porta hepatis from before backwards, if you see the relation, okay, so at the porta hepatis, before it enters and divides porta hepatis, before backwards we will see right and left hepatic ducts. This is the arrangement, right and left hepatic ducts. Then we will see right and left hepatic arteries. And then we will see the right and left branches of portal vein. So this is about the extrahepatic course. So here there are few tributaries of portal vein which join before it opens into the liver, that is before its intrahepatic course. So here if we see the superior mesenteric vein, okay, so this is the formative tributaries, superior mesenteric vein and the splenic vein. They form the formative tributaries. Other than this, we have the right gastric. Here we have the right gastric, right and left gastric, right and left gastric veins. So this is usually they open into the trunk of the portal vein, right and left gastric veins. Then the right one, cystic vein. Okay, so cystic vein will be opening into the right branch. Cystic vein opens into the right branch of portal vein, and there are para-umbilical veins which will open into the left branch. Okay, the left branch will have the para-umbilical veins also opening there. So these are the tributaries. Other than this, sometimes we can also see this is the inferior mesenteric vein which may open into like the portal vein, and the right gastro. So these are we will see sometimes. Okay, so right gastroepiploic, right gastroepiploic vein and prepyloric vein of Mayo. Okay, so these veins may occasionally open into the portal vein, but otherwise we have the formative vein, superior mesenteric, splenic vein, right and left gastric veins opening into the trunk, and cystic vein opening into the right branch, and para-umbilical veins into the left branch. So these are the tributaries. So why is this portal system? What do we mean by the portal system? So as I said earlier, the portal vein basically drains the abdominal part of the GI tract except for the lower rectum and anal canal. Now there are certain peculiarities of this portal vein. So if you see the portal vein, it begins like the veins. Okay, so begins like veins from the capillaries here, from the capillary plexus of the gut. So basically it is taking the not only the toxins, okay, the waste, but as well as it is also taking the nutrients. So whatever the digested food, okay, so absorbed products of the digested food, the nutrients are also taken by the portal vein. So it begins like veins from the capillary plexus of the gut and ends like arteries. Okay, so this is the gut. So here it begins like the capillary plexus and then it ends like arteries. Like you saw, I said it is right and left branch. Usually for veins we say tributaries, right? But here it is branching out. The tributaries were coming and opening into it, but the portal vein goes and branches out into right and left. So that is why we say it like it ends like arteries. So it ends like arteries by dividing into hepatic sinusoids. So in the liver, it divides into, after dividing into right and left branch, it opens as hepatic sinusoids. These portal veins, they are devoid. See, veins usually we say they have valves, but here it is devoid of, there are no valves. Okay, it is devoid of valves. Valves are not there. And it also acts as a reservoir. This portal vein, it acts as the reservoir of blood. That is about 1/3 volume of the entire blood is stored in this portal system. And two streams of blood, okay, two streams of blood, they circulate through the trunk of the portal vein. Okay, so there is the superior mesenteric, from the superior mesenteric and then from the splenic. So usually the superior mesenteric goes along the right branch and the splenic, whatever the blood coming from the splenic, goes towards the left branch. So out of the 1500 ml of blood circulating through the liver, okay, so about 1500 ml of blood per minute is circulating in the liver. Out of that, about 1200 ml is provided by the portal vein alone, okay, on only 300. So this is by the portal vein, whereas only 300 ml is by the hepatic vein. So that is why the portal vein is of very much importance. So inside the liver, we will see the intrahepatic part. Okay, so the right and left branches of the portal vein, as I said, this is the right and left branches, they open. Okay, so they supply the physiological right and left lobes. So physiological right and left lobes we divide by an imaginary line. Okay, passing through the groove for the inferior vena cava and for the passing through the fossa for the gallbladder. So here we have the right and as well as the left physiological lobes of the liver. So here the portal circulation in the liver, it goes this way. So the right and left branches, okay, so the portal veins, that is the two branches, they open into the portal canal. And the portal canal, okay, opens into the hepatic sinusoids. Okay, so the hepatic sinusoids, okay, so basically after providing the nutrition to the liver and all, it opens into the central vein. And central veins, they join to form the sublobular veins, and sublobular veins, they open and join to form the hepatic veins, and these hepatic veins open into the inferior vena cava. So that is how the blood reaches, finally the venous blood reaches the heart. So portal veins drain into the portal canal to hepatic sinusoids to central veins, then sublobular veins, then to the hepatic vein and inferior vena cava. So that is in short about the intrahepatic course and hepatoportal system. Now let's look at the portocaval anastomosis. So there is this anastomosis, okay, so there is a collateral anastomosis between the portal system, the tributaries of the portal system, as well as the tributaries of the systemic circulation, that is vena-cava system. Okay, so and these sites, they are very important because whenever there is any portal obstruction, there will be dilatation of this vein, engorgement of these veins, and it results in certain clinical conditions depending upon the site. Like we have esophageal varices, we have hemorrhoids, internal hemorrhoids, then we have the 𝗕𝗵𝗔𝗟 on the umbilicus and such. So let's look at those. Okay, so there is portocaval anastomosis if we see. So basically it is the anastomosis between the portal veins and the systemic veins, that is the vena-cava, belonging to the vena-cava systems. Okay, so this is the vena-cava system. Okay, so there is this anastomosis between portal veins and the systemic veins in portocaval anastomosis. So let's look at the sites. So as I told you, the lower end of the esophagus or the lower end of the rectum and the anal canal. Okay, then there is near the splenic and the kidney. Okay, behind the bare area of the liver. So there are many sites where the anastomosis takes place. So let's look at that, the different sites where the anastomosis takes place between the portal system and the vena-cava system or the systemic veins. So the first important site is at the lower end of the, so here this is the lower end of the esophagus. So lower end of the esophagus here. Okay, so lower end of esophagus. So here if we see here, closer view, okay, so here the anastomosis. So esophageal, so if you see the esophageal tributaries, so this is the the portal vein here. So the portal vein, basically the esophageal tributaries. So here from the portal system, we have the esophageal tributaries which belong of the left gastric. Okay, esophageal tributaries. So esophageal tributaries of left gastric vein, that belongs to the portal system, and this will anastomose with the, here if you see, this is the esophageal tributaries of hemiazygous vein. Hemiazygous vein. So these anastomose at the lower end. So lower end of the esophagus mainly is between the left gastric vein belonging to the portal system and the esophageal tributaries of hemiazygous vein belonging to the vena-cava system. Then another next important site is the lower end of the rectum and anal canal. Okay, so here the lower end of rectum, and anal canal. So here the veins belonging to the portal system is the superior rectal vein. So superior rectal vein belongs to the portal system. Okay, superior rectal vein. Whereas the middle and the inferior, okay, middle as well as inferior rectal vein, they belong to the systemic or the vena-cava system. Okay, systemic veins. So the anastomosis happens here. Okay, so when in portal hypertension or portal obstruction, what can happen? The radicals of the superior rectal vein in the anal columns here, if you see in these anal columns, the superior radicals are nothing but the tributaries there, which will dilate, okay, which will cause distend, and they produce internal hemorrhoids. So that is the thing. And here also at the lower end of esophagus in portal hypertension, so the walls of these veins may rupture. Okay, they are thin walled as such, the tributaries of the veins, so they can rupture, and that can cause severe hematemesis. Hematemesis is vomiting of blood. Then the next important site is at the umbilicus. Okay, so at the umbilicus here, umbilicus. So here the para-umbilical veins. The para-umbilical vein belongs to para-umbilical veins. They belong to the portal system. Okay. Whereas from the systemic we have from different regions coming there. So from above we will have, okay, from above we will have the superior epigastric, and lateral thoracic. Okay, lateral thoracic veins. They come from above. And from below we will have the superficial epigastric vein as well as the inferior epigastric vein. Okay, and from the sides we will have the posterior intercostal as well as the lumbar veins. So these veins, they form the portocaval anastomosis around the umbilicus. So in portal obstruction, what happens? The tributaries of the systemic veins, okay, these tributaries, all of them, they are distended like spokes of wheel. Okay, spokes, they are distended and they look kind of tortuous. So that is why it is called as 𝗕𝗵𝗆. Medusa is a Greek mythological character where her hair was like, it was actually snakes. The snakes are hair, instead of hair she had the snakes. She was cursed and she had snakes as hair. Okay, so that is why it's called as the 𝗕𝗵𝗆. And this, since these veins, they get distended and they look tortuous, we call it as 𝗕𝗵𝗆. So these are some of the sites, important sites where we have these portocaval anastomosis. In addition to this, we also have certain sites where the portocaval anastomosis takes place. So let's look at that. So other than the three main sites, other sites where we see the portocaval anastomosis is, one is behind the peritoneum. Behind the peritoneum of the posterior abdominal wall. So here if you see, here the splenic, so this is the splenic vein, the colic vein, this is the left colic vein, which belong to the portal system, the anastomose. Okay, so here if you see, they communicate with the left renal vein. Okay, so this is the radicals of left renal vein, and other tributaries of the inferior vena cava by a number of small veins, and these veins we call it as the veins of 𝗕𝗵𝗃. So basically here behind the peritoneum in the posterior abdominal wall there is anastomosis between the splenic vein and the left colic vein, which belong to the portal system, with the veins, that is radicals of the left renal vein, okay, as well as small tributaries of the inferior vena cava, which are known as the veins of 𝗕𝗵𝗃. So this is one side. Then the other side is, so one was behind the peritoneum, and the next side here at the bare area of the liver. Okay, so at the bare area of liver, so here what happens? The portal radicals. Okay, so the portal radicals of liver, so they are basically belonging to the portal system. They will anastomose. Okay, so the portal tributaries or the portal radicals of liver, which belong to the portal system, they will anastomose with the diaphragmatic or the phrenic veins. Diaphragmatic or the phrenic veins, which belong to the systemic circulation. Okay, so with a number of small veins, they will anastomose with each other. So this is the other side, that is behind the bare area of liver. Then we also see in the falciform ligament. So this is the falciform ligament here. So in the falciform ligament, the para-umbilical veins. Okay, so the para-umbilical veins here, which belong to the portal system, they will anastomose with the phrenic veins. Okay, so that is those are the sites of anastomosis. So this is one more site, and in the fetal thing we can see the portocaval anastomosis in fetal life. Okay, so this is one thing which you need to keep in mind. This we see only in the fetal life. Okay, in the fetus. So where do we see that? That is in the fissure for the ligamentum venosum. So at the fissure for the ligamentum venosum, what happens? The left branch of portal vein. Okay, so left branch of portal vein communicates with this one with inferior vena cava through the ductus venosus. Okay, so after birth, this ductus venosus becomes the ligamentum venosum. This we see only in fetal life, right? So these are the different sites of portocaval anastomosis. The most important being lower end of esophagus, then the lower end of rectum and anal canal, as well as around the umbilicus. So why do we need to know this? What is the importance of portocaval anastomosis? So what happens in portal hypertension or portal obstruction, particularly usually it is because of liver cirrhosis. So here the backflow of portal blood. Okay, so there is a backflow of portal blood, and this portal blood, the backflow happens through the radicals of the belonging to the systemic circulation. Okay, so through when I say radicals, it basically the tributaries. So backflow happens through these tributaries belonging to the caval system. So this happens even before the blood reaches the right atrium. Finally it has to reach there, right? So before it reaches there is the backflow. So if the anastomotic channel, okay, if the anastomotic channel remains impervious, when you say impervious, basically it doesn't allow to pass. Okay, so that time the ascitic fluid, okay, so the ascitic fluid, it accumulates in the peritoneal cavity. Okay, it accumulates in the peritoneal cavity, and due to the venous stasis. So the ascitic fluid remains because of the backflow, and there is the more ascitic fluid collects in the peritoneal cavity because of the venous stasis. So when there is ascites in portal obstruction, it is indication, it is an index of failure of anastomosis between the portal and the systemic veins. Okay, so ascites is always associated in portal hypertension, okay, with the failure of portal and systemic anastomosis. So in those cases, sometimes the esophageal the veins varices, they will rupture, producing hematemesis. So in such conditions, usually what they do is they do a portocaval shunt. Okay, portocaval shunt. So it's just an attempt there to control this. So that is known as X fistula operation. So here what happens? They anastomose the splenic vein with left renal vein. Okay, so with or without splenectomy. So this is known as the X fistula operation. Other one which is commonly done is the TIPS procedure, that is transjugular intrahepatic portosystemic shunt. Transjugular intrahepatic portosystemic shunt. Okay, so here what happens? The balloon catheters are introduced through the internal jugular vein, and that can be passed down, okay, from the internal jugular vein. Where will it go? Finally it goes to the superior vena cava, and then from there to the right atrium, the inferior vena cava, okay, to the hepatic veins. So that is what is done. So that is known as the transjugular intrahepatic portosystemic shunt. So let's now solve some of the MCQs. So here a labeled image shows splenic vein joining another vein behind the neck of behind the pancreas. Identify the labeled structure. So which is this vein? The formative tributary of portal vein is the superior mesenteric vein. Yes, so B is the right answer. Next, coming to the next question. in a diagram showing classical sites of portocaval anastomosis, label X is at the umbilicus. Yes, which veins are involved? So, which veins are involved there? The paraumbilical veins belonging to the portal system, and we have the systemic veins, that is the from above we have the superior epigastric vein and the lateral thoracic, then we had from below we had the inferior epigastric as well as superficial epigastric, then from the sides we had the posterior intercostal and lumbar. So, here what have they given? They have given paraumbilical and superficial epigastric. So, A is the right answer. Next question, a diagram shows venous drainage of rectum. Label X indicates the vein draining into portal system. So, at the rectum, junction of rectum and anal canal, which vein? Mainly portal vein, we have the superior rectal vein, and belonging to the systemic, we have the middle and the inferior. So, here we have the superior rectal vein. So, C is the right answer. And that's a wrap for portal vein and portocaval anastomosis. So, consistency is the key to success. So, stay consistent with this series. I will see you in the next session.